Hello, my name is Tara Ronsleben. I am a graduate student certified in human sexuality working on a master's in the field, and I think we should talk about contraception. This is episode 2 of my Sex Ed 101 series covering topics that you may or may not have covered in school, but probably should have. This is actually going to be a multi-part series on contraception, as there's a lot to cover. Now, contraception refers to any method used to prevent pregnancy, and there are a lot of different things under that overall category, and they all come with some benefits and some downsides, so let's explore our options. Contraceptives come in hormonal and non-hormonal forms and in methods that are used continuously or just prior to intercourse. There's also the option of sterilization, which permanently, surgically removes the ability to conceive. But for now, we're just going to be covering the non-hormonal options for contraception. The most well-known form of contraception, and the only form of contraception that also protects against STIs, you're going to hear me repeat that a lot during this video, is the condom. What you may not know is that there are actually two kinds of condoms: the external condom, the kind you're most familiar with, and the internal condom. Both protect against STIs and pregnancy, but only if used correctly and used every time. Let's start with the external condom. The external condom is 98% effective when used perfectly, but 85% effective with typical use. Now, typical use means that, accounting for user error at 85%, 15 out of 100 people every year will get pregnant using only condoms as their form of birth control. There are several ways to increase the effectiveness of a condom. Wear them from start to finish, use them for oral, vaginal, and anal sex. Make sure to check the expiration dates before use. Never use more than one condom at a time. Never reuse a condom. Change the condom when switching between orifices or partners. Use it in combination with other forms of birth control, and always use it correctly. Here's how.
The first thing you'll need to do when you have a condom is to make sure it is within its expiration date. It's a little difficult to see on this one, obviously, as the foil is quite reflective, but it will be printed on the back of the condom, usually near the lot number and the production date. You will then need to open that carefully, making sure not to rip it. Start to unroll it. Always unroll it the wrong way first, and then start rolling it the right way. It's only going to really roll one direction. Oh, don't knock over your penis. You will then make sure to pinch the tip as you are rolling that down over your penis or penis adjacent toy. Make sure that condom is securely all the way to the base, and it should look like this.
Condoms are actually ideal to be combined with other forms of birth control, as it not only increases the effectiveness of preventing pregnancy, but also adds that protection against STIs. Condoms don't come with any risk factors unless, of course, you're allergic to latex. However, most brands have a whole line of latex-free products, and some brands, like skin condoms, are actually all made latex-free. Never use an oil-based lubricant, even something like coconut oil, with a condom, as the oils can degrade the material of the condom and make it much more prone to breakage. A regular old condom like this can also be cut and used to make a dental dam for oral or anal sex. Here's how you do that.
In order to create a dental dam from a condom, you will once again check that expiration date, and then you will unroll it completely and cut off the tip of the condom and the base of the condom. You will then have essentially a tube there, and you will take your scissors and cut right down one side of that tube to create a rectangle of latex, or not latex in this situation, and you will then be able to hold that taut over either a vulva or an anus and then lick through that for oral sex. This will protect you from STI transmission, but also might make some people more comfortable with oral sex. In this clip, I just wanted to demonstrate exactly how stretchy a condom is. I can actually fit my entire fist in one. I'm clearly struggling a bit in this clip, but normally that would be less of a struggle. I must have just been having a rough day. But anyway, as you can see, I can fit my entire fist in that. I can stretch out that fist, and it is not breaking. I could honestly probably fit a condom over my entire head if I wanted to, but that's not a thing I want to do. So anyway, as you can see, stretching, not breaking, until we bring in oils. This is just coconut oil, but oil-based lubricants will do the same thing. Those oils will degrade the latex and even non-latex condoms. As you can see, obviously it doesn't immediately do it, but add friction to this situation, and it makes condoms much more prone to breakage. As you'll see, oh, there it goes, snapped in half. You don't want that to happen during sex.
External condoms can be found just about anywhere. Grocery stores, gas stations, drugstores, sex shops, online, but some places do require an employee to retrieve them from behind a lockbox for you. There are no age restrictions when it comes to purchasing condoms, and there's no shame in buying condoms either. Most sexual health clinics and a lot of school campuses will also offer them for free, so check that out if you have somewhere like that near you. Remember how I said there are actually two kinds of condoms? There's the external condom, which we just covered, and then an internal condom. The internal condom was previously called the female condom, which was never the most inclusive name, especially considering it can be used for both vaginal and anal sex. The internal condom has a slightly lower rate of effectiveness at preventing pregnancy, mostly due to people being a lot less familiar with how to use it properly. With perfect use, the internal condom has a 95% effectiveness rate for preventing pregnancy, but that drops down to about 79% with typical use. However, because it has an increased surface area coverage, the internal condom is actually slightly more effective at preventing the spread of STIs. FC2 is currently the only FDA-approved internal condom brand available in the United States. It is non-latex and pre-lubricated, however, it does require a prescription to access. Now, this sounds like a bit more of an ordeal than it actually is because that prescription can be accessed through Telehealth Services. You go to their website, answer a few questions, they send that off to a prescriber who approves the prescription, sends it to a pharmacy, and then they can mail it directly to your home. Because it goes through a prescription, if you have insurance, it is often completely covered by your insurance and you can receive it completely free. However, I did attempt to order some for demonstration purposes for this video, and I ran into some issues with my insurance. So I have received them previously through insurance on the same carrier, but I am on a different plan now and they are considered a plan exclusion. In this case, the pharmacy called me, said, hey, your insurance isn't going to cover it. I said, okay, don't fill that prescription, no harm, no foul. They are apparently somewhat accessible without insurance and prescriptions. However, they are pretty exorbitantly expensive. I don't know why. Take that up with Big Pharma. We already have beef. The key to both types of condoms is using them every time and using them correctly every time. Please note that the internal condom, while it can be combined with a lot of other forms of contraception, cannot be used with an external condom. That sort of friction just is a recipe for breakage. The next two contraceptive methods, also both barrier methods, are honestly not quite as popular as they used to be. Those are the diaphragm and the cervical cap. Now, this is not a diaphragm, this is actually a menstrual disc, but it is quite similar in form and function to a diaphragm. The cervical cap is more like a thimble, but both are inserted through the vaginal canal and then sit directly under the cervix. In the case of both the diaphragm and the cervical cap, the inside is filled with spermicide, so they act as both a barrier method preventing sperm from accessing the uterus and also a vessel for holding spermicide, which we'll discuss a little bit more later. Spermicide is necessary for these to function properly, and spermicide will need to be added between each round of intercourse. Diaphragms and cervical caps have similar rates of effectiveness, 88% with perfect use, 83% with typical use, and neither protect against STIs. They are reusable, however, unlike a condom, but they do require a prescription and they require a doctor to fit them properly to your cervix. It's a bit difficult these days now to find a doctor who is willing to prescribe either a diaphragm or a cervical cap and also trained in how to properly fit them, as there are newer, more effective forms of birth control on the market. The diaphragm will need to be replaced every 2 years. The cervical cap needs to be replaced yearly. Both diaphragms and cervical caps, like the internal condom, can be inserted way prior to intercourse, but unlike the internal condom, they can also be combined with the external condom, increasing your protection. After sex, both the diaphragm and the cervical cap will need to be left in for at least 6 hours to be effective. The diaphragm can be left in for up to 24 hours. The cervical cap can be left in for up to 48 hours, but they both need to be left in at least 6 hours in order to be effective. Contraceptive sponges are another less common form of birth control. Now, they're basically exactly what they sound like, little round sponges filled with spermicide with a little fabric loop to help you remove them afterwards. They can be combined with external condoms and are 91% effective with perfect use, but about 80% effective with typical use. That 80% figure is actually pretty interesting because the rate of effectiveness for contraceptive sponges is actually dependent on your history of having given birth. Women who have never given birth vaginally actually have an 88% effectiveness with typical use with a contraceptive sponge, but women who have given birth, it actually drops down to about 76% effectiveness. Sponges do not protect against STIs, but like I said, they can be combined with an external condom to add that protection. Once placed, the sponge can be left in for 24 hours, regardless of how many times you have sex within that 24 hours. Like diaphragms, though, sponges do need to be left in place for at least 6 hours post-sex, meaning they can stay in for up to 30 hours, but don't leave them in any longer than that. Sponges are not reusable, but they can be purchased over the counter and can be found at pharmacies, sexual health clinics, and online. I did try to purchase some contraceptive sponges, once again for demonstration purposes for this video. However, the Today sponge, which is the only brand available in the United States, has had some mechanical failures in their factory and due to COVID-19 restrictions have not been able to manufacture sponges. So they're off the market for now. There are also non-hormonal options that don't work by providing a barrier. That spermicide that is used with a lot of the barrier options mentioned earlier can also be used on its own. Now, spermicide, the name, sounds like it is killing sperm. However, it's actually just slowing them down, which is why it's often used in combination with other forms of birth control. When used alone, it is only 82% effective with perfect use and 72% effective with typical use. Spermicide does not require a prescription and can be found at most of those places you can also find a condom. So, drugstores, grocery stores, sex shops, online. Spermicide also comes in tons of different forms. So there's gels, there's creams, there's foams, there's suppositories, and then there's films, like these.
These are the vaginal contraceptive films. They are a form of spermicide. I'm pointing there to the active ingredient. And then on the back, we have the expiration date, important to check. These you will open up, and inside is a film. So it's kind of like a little Listerine strip, honestly, but bigger and a lot less minty. You'll open that up, fold that in a U shape, and use a finger to insert that up the vaginal canal and as close to the cervix as possible, where it will start to dissolve on moisture. These particular ones, you need to let sit for 15 minutes in order to dissolve before you begin having sex. As you see there, you don't want to use wet fingers when inserting them or they will start to dissolve much too early.
Spermicide does not protect against STIs. As a reminder, only condoms do. And spermicide can actually increase your risk of receiving or transmitting an STI because the chemical ingredients in spermicide are often quite irritating to the sensitive skin of the genitalia. That irritation is actually tiny, tiny micro cuts of the skin, which means transmitting any sort of infection or disease is much more likely. Because there are so many variations of spermicides, it's very important to read the instructions on the one that you have and are using so that you know exactly when and how to apply it. Now this next one is a little newer to the market. It's called Phexxi. If you have heard of Phexxi, it's probably because you've seen those ads with Annie Murphy, who plays Alexis on Schitt's Creek. A great show. So Phexxi works very similarly to spermicides in that it slows down and confuses the sperm and makes it much more difficult to get them anywhere where conception could occur. However, instead of using the sort of chemical ingredients that are in spermicides, Phexxi uses lactic acid and citric acid, which are both naturally produced in the beautiful ecosystem that is the vagina. These acids help keep the vagina at an acidic level even when semen is introduced. If you've seen my video on anatomy, you will know that the purpose of semen is to reduce the acidity of the environment because sperm move much more easily in a basic environment in pH terminology. This is another one that's a great option to combine with another form of contraception, especially non-hormonal forms of contraception, although it can also be combined with hormonal options, except for the vaginal ring, which we will discuss in my next video on hormonal options for contraception. Phexxi is inserted up to 1 hour prior to sex using the pre-filled plastic applicator, kind of like the kind you use to insert a tampon. Now, if you have sex more than once or your timing is a bit off and it's been more than an hour since you last inserted a dose of Phexxi, you will need to use another dose of Phexxi. Because it alters the pH levels of the vagina, if you are someone who is prone to yeast infections or UTIs, this may not be the best option for you. The acidic nature of the Phexxi gel has also been shown to be irritating to the skin of the penis sometimes. So if you are having sex with a penis-having partner with sensitive skin, it also might not be the best option for you. Phexxi is available through a prescription, so it is one that you would have to chat with a doctor about in order to access, although I'm sure it is also available through Telehealth Services. So, last one. I know it's a lot of info, just wait until I get started on hormones. This last method is not one that I would recommend unless you are in a place where if you did get pregnant, it would be something you could handle, because it is a bit more difficult to do properly. This is called the cycle tracking or fertility awareness method. It's also often called the rhythm method or the natural family planning method. This method involves tracking your menstrual and ovulation cycles in order to be aware of the days in which you are most likely to conceive, and then either avoiding sex on those days or using another form of birth control like a condom or the pull-out method. A quick note about the pull-out method. Now, the pull-out method statistically is 98% effective when done perfectly. Now, that's the key, perfectly. It is very difficult to do perfectly, meaning that no semen comes into contact with the vulva or vagina at any point. Because it is so difficult to do perfectly, it's actually closer to about 78% effectiveness rate. That means 1 in 5 people who are only using the pull-out method will become pregnant every year. So not one I would recommend using as your sole method of birth control unless you are ready to start shopping for diapers. However, the pull-out method can be combined with literally all of the other ones. So it's great to ensure a little extra peace of mind when it comes to preventing pregnancy. But back to cycle tracking. It can be difficult to accurately predict exactly when you're ovulating. And it's important to know that you can actually get pregnant at any point in your cycle, including while you are actively menstruating. That makes this one of the less effective forms of birth control at only a 76% effectiveness rate. It is more effective when done in conjunction with a nurse, a doctor, a fertility planning specialist who is well versed in the methods and the tracking methods that you can use. And it's also more effective when you use multiple forms of tracking your cycle in order to be more accurate on exactly when you are fertile. So as I said, there are multiple ways to track your cycle, so let's discuss the 3 most popular. The first one is called the temperature method. Now this is done by checking your temperature using a mouth thermometer every morning, first thing in the morning before you even get out of bed. This is measuring what is called your basal body temperature. Your basal body temperature is the temperature of your body completely at rest. This is used to track because your basal body temperature is actually slightly higher during ovulation. Then there's the cervical mucus method. The cervical mucus method involves getting very familiar with your vaginal discharge. Cervical mucus changes in amount, color, and texture throughout your menstrual cycle. Right before and during ovulation, your cervical mucus is going to be at its heaviest. You are going to notice that it is more clear and slippery, kind of like the consistency of egg whites, and it will also be able to be stretched between your fingers. This can last up to 4 days prior to and during ovulation. The last method is the calendar method. Now, this is good old cycle tracking. This is making note of the days in which you are menstruating and then doing the math from there. So on a typical 28-day cycle, that means that you would be ovulating 14 days after your first day of menstruation. However, this requires that you have a very regular cycle that is 28 days, or at least a very regular cycle where you can do the math and figure out where your halfway point is. There are also other ways to notice when you are ovulating. Some women experience what is called Mittelschmerz, which is a type of ovulation cramp. Many women have an increased sexual desire during ovulation. It alters your sense of smell and even changes your saliva. Bodies are so interesting. I fully believe that tracking your cycle and being aware of the signs that your body gives you about ovulation is important information to have about your own body, and that everyone should be comfortable around the ideas of discharge and menstruation because they are totally normal. However, this is a method that can be kind of tricky to be accurate in. So, like I said, unless you are open to the idea of potentially getting pregnant, this is not one I would recommend. And once again, it does not protect against STIs, obviously. The only form of contraception that protects against STIs is condoms, whether they are external condoms or internal condoms. Condoms can be paired with all other forms of birth control, and they're just always a good idea because there's nothing that ruins the mood more than being worried about how protected you are. As I said at the beginning of the video, this is just part one of our conversation on contraception, as there's a ton to cover, and this is just most of the non-hormonal options. In fact, I lied. I didn't cover all of the non-hormonal options because there is a non-hormonal IUD, the copper IUD. However, I will cover that in part 2 when I discuss IUDs more fully. We've gotten to the dreaded outro part. I actually just wrote outro mumbling in my script because that tends to be all I do. But thank you for watching. I hope you learned something. I hope you didn't learn something. I hope this was information you were given in school, but if you weren't, I'm glad you got it from me, and let me know if you have anything to say. What am I saying? I don't know. Like my videos, please leave a comment, subscribe to me, and I think my Instagram's linked as well if you want to follow me there. I actually just started making TikToks and I'm very bad at it, but if you would like to see me learn how to do those a bit better, I will link that as well. So thank you for watching. Bye. Love you. Mwah.